We tackle a topic that few people want to discuss. It's a condition that can create all sorts of confidence problems at any age. I'm talking about acne. It's not just a problem for teens. It can carry over into adulthood. And most people look for solutions in their local drugstore. My guest today has more options that can deliver dramatic results. Dr. Drannetherese Stubbs of Drannetherese Aesthetic Medicine is joining me once again. Dr. Ann, nice to have you here.
Thanks for having me back.
Acne really can be a confidence deflator. Because we are many times how people those first impressions,
right.
And I'm sure you see that all the time. So it can have an effect on a person's psyche, can't it?
Definitely. It can be very debilitating to self-confidence, especially in the teen years when kids are just kind of forming their self-image, but also in adulthood too. You mentioned it. We see a lot of adult acne as well, and I'll have patients say, I thought this was supposed to leave with my teenage years. Why am I still getting all these breakouts? And then it can lead to scarring. And
that's a lifelong result.
Yes.
What is the cause of acne? When I was growing up, it was don't eat chips and chocolate.
There's a lot of food myths that go along with acne, exactly. But really, it's an overproductive oil gland. The pilosebaceous gland is this gland that puts out a lot of oil. When kids hit puberty, it ramps that up, and so there's just a lot more oil production. Some of it can be genetic as well. You'll see kids with a great deal of acne and kids with mild cases. And then some people can have it also hormonally into their 40s as well. But it's that oil gland, a lot of production of oil. The pores get clogged with the oil and the dirt, and then bacteria can get trapped underneath it. And you've seen kids with very big cystic kind of lesions, big red inflamed acne lesions, and those are from the bacteria getting trapped down under the skin. So it's oil on top, bacteria underneath.
So obviously just topical drugstore stuff isn't going to solve these kinds of problems. How can you help?
Well, basically, the caveat has always been put these kids on antibiotics or these adults on antibiotics. There's a lot of new light-based devices that can keep people off antibiotics now. There still is a role for antibiotics in very severe acne cases, but there are topical things to clean the face with. Salicylic acid is something that you'll find in a lot of over-the-counter products, and we use it in higher concentrations in some of the acne facial washes. It takes or degreases the skin and takes the oils out. And then we use a light called blue light. It's 400 nanometers wavelength of light. Someone discovered that this is actually an antibacterial. So we put kids in this blue U. It's just a 16 minutes standing in front of a blue light in the office after maybe an acne facial where we've cleaned out all the pores, and the blue light kills the bacteria, really clears up the skin quickly.
So how often do people have to come back for these sorts of procedures?
Depending on the severity of the acne, we recommend first patients come in for a consultation, and I usually tell them bring the whole bunch of products they're using on their face, dump it all out in front of us. We can easily say this one works, this one doesn't. You know, a lot of things have a lot of heavy perfumes, and they may actually be detrimental to the skin. So we can kind of pick out the products that are actually working to degrease or de-oil the face, and then we can clean out the face with an acne facial. These are facials that are actually very medically proven to kind of clear out the blackheads, the offending oils, if you will, and then we can get the medicine, the topical medicine like the retin-A's and some of the light-based devices to kind of penetrate deeper.
And also lasers. You've mentioned the Fraxel laser really does wonders. How does that work on acne?
The Fraxel is a high-powered laser that kind of fractionates the laser beam. Lasers are thought to always peel the skin, and this one doesn't peel the skin. It kind of, you know how your lawn gets aerated, little dots? That's exactly what this laser does. Little dots of energy that go down into the skin, and they cause the collagen to build, so it combats the scarring. It also shuts down the oil gland. So active acne patients are helped by it a great deal.
And that's what we're looking at now. And this really is a dramatic difference.
Yes, you'll see the before pictures on top. And this gal, when she walked into my office, wouldn't even make eye contact with you. Her face was just covered with the red, inflamed acne lesions that you see on the top row there. And afterwards, she did some acne facials about once a month to kind of clean that out. Had some topical retin-A we were using, and then we began the Fraxel treatments to start to combat the scarring and decrease the redness and the active acne breakouts as well.
And we have some more dramatic pictures, and this is how the Fraxel works on scarring. And this was another amazing before and after to me, Dr. Ann. I mean, look at that. And people really think they have no options. That's the sad part.
There's lots of options. There are. And dark-skinned individuals normally were not laser candidates. The Fraxel can be used on even the darkest of skin. So this is somebody with darker skin. The before picture, deep pitting. That's after 4 Fraxel treatments. And we can probably even go further and do one every 2 months or so and get more collagen build under that and smooth that out.
So you have a lot of options for folks to take care of the acne currently if they're suffering, and also the scarring. But they need to see you to see what's going to work best for them.
Exactly, and it's just a matter of kind of that initial consultation, seeing also what their lifestyle's like. If there's a lot of kids who come in, or even young adults who are athletes, right after football season when the helmet's on and the face guard and everything, that is something that just even using a good product at home to cleanse the face after every football practice can make a huge amount of difference. That and the Clarisonic, which is an ultrasound brush.
Oh, yeah, the Clarisonic. We've had that on before. People love that thing. Dr. Ann, thank you so much. Nice to talk with you and get good advice.